I'm Tim Ventura, and we're joined today by Anastasia Egorova, the founder and CEO of Open Longevity and the vice president at the Science for Life Extension Foundation. Anastasia has a background in business, creative design, and has studied molecular biology and physics at the Moscow Institute of Physics and Technology and clinical monitoring at MGMSU. She joins us today to discuss the goals, research, and progress happening in longevity and life extension, and describe how community activism and organizations are helping to improve anti-aging medicine. So Anastasia, welcome. Thank you so much for joining me today. Let me start by asking you for kind of an overview of the Open Longevity Project and what its goals are.
Thank you for having me, first of all. It's lovely. So Open Longevity is a nonprofit organization. We started as a community 6 years ago. So I'm getting used to people are calling us Open Longevity community. That's basically what we are. That's true. But we are also a traditional nonprofit. So we receive donations and then we spend it to longevity research, to research in biology of aging mostly. But that's not all what we do. We're also trying to come up with new organizational solutions for the field, because we're feeling that the field of longevity and the field of radical life extension is not growing fast enough. I would even add that, longevity field does exist, sort of, but if we're talking about radical life extension as a field, sadly, it's close to not existing. So, we have to establish the field for us. We have to collectively, not only we as Open Longevity, but all of us who want to stay alive, we have to come up with the solutions, how to expand the field, how to create the basis for it. Maybe some tools are lacking. So maybe we'll need some new, like Wikipedia kind of tools first to then build on this basis. So that's what we're trying to do, come up with all those basic solutions for the field, come up with organizational solutions, because we also think that it's not only enough to launch traditional research, biology of aging research, which is very much needed, and we do so. We have our vision of what research must be done first, but also, a lot of people are agreeing with the idea of transhumanism and the fact that dying is bad, staying alive is good. And most of the time they're just asking us, okay, what should we do? How should we join the movement? And of course, it's not that easy to give instructions, especially for the people who are not scientists by background. But it is a force of nature, all those people that want to stay alive. So for us, it's a very complicated task, but it's a very important one to solve this, how to include all these people, how to actually build the community.
Well, so now there are over 7,000 members in Open Longevity so far. So what kind of people typically become members, and what do they contribute? What do they bring to the community?
If you're referring to 7,000 people, you're most likely talking about 7,000 subscribers, members of the group. That's true. Technically, they're members of the Facebook group of Open Longevity. But there are a number of ways how you can join us. We have active volunteers, not 7,000, several of those, but they're great, very helpful. So how can a person join right now? Be a volunteer, help us with the translation, help us with some IT. It's always needed. If you're a scientist, actually we can come up with the tasks for any professions, any professionals. What type of people are usually approaching us? Yes, there is a profile of a person, of a transhumanist who usually joins us. Most of the times, these are people with technical background, or IT background, logical thinking. Makes sense. A transhumanist usually, not always, but usually has some background in science or engineering. So yeah, mostly men for some reason, but no, you know what? I don't really have like exact data on that, the profile here, but it's just like a feeling. Mostly men, IT background, 30, 40, 50-ish, maybe with some business of their own in IT, or they're like high-level professionals there, so they actually have some free time. So yeah, this is our core audience there.
That makes sense. That makes sense, right? I think one of the things that I've kind of picked up from transhumanism is maybe a more mechanistic way of looking at the body. The body is a machine, it wears down, age, like any other machine out there. And so to have people who view it from that perspective, it makes sense that they would want to fix it, right? They would want to find ways to repair that damage. Now, on your website, and you mentioned this earlier, the research and development is out there in a sense, but it's lacking the needed scale and pace. And so you also mentioned one of the things that you're working on that's I think is exciting is organizational solutions. You're also working on research and data mining and a lot of other things. Could you tell me about the scale and pace part of that?
Oh yeah, well, if we want to stay alive, like you and I, I've been in the field for several years. There are people who were in the field for several decades, and like, frankly, it is a little bit depressing, like being in the field for several years, because you don't really see the result. You're being introduced to it like at some point of your time, and you're getting very excited, like, oh, the scientist has come up with this and that. Oh, that looks very promising. I can feel it. Like within several years, I will have some therapy that I will be able to apply to myself. And it looks very exciting at the beginning, and then you can see that, so like 1, 2, 10 years has passed, and nothing new has actually happened. Am I making it all the time? Doesn't seem so, and it's devastating, of course. So yeah, of course we need to come up with some solutions that will work exponentially.
Yeah.
We cannot afford ourselves to go with the existing pace of research in our field, because it's our life that's at stake, and the lives of our relatives or friends, So yeah, what do we do? That's one of the optics we apply when we choose what scientific task to tackle or not. Like, does it look like everybody are doing that, or is it something that only we can do? Not that we're like some scientific geniuses and nobody else came up with the same idea. No, it's just most of the scientific research is being done within traditional academic environment. So most of the scientists are just applying for the grants, and they're playing by the rules created before them. They're just agreeing to the existing rules, and they're operating within them. And so not all of them can afford some very bold ideas that will look, weird in terms of their career, or, it's weird enough. Sometimes it's easier to fundraise for the ideas that are already on the market, already in the field. Like the investors, they can see like a number of projects. If we're talking about startups, the commercial part of our field, if they see that there's a number of startups and they look good, sexy enough for the investors, other investors, they say, okay, that doesn't look too risky for me. I will do the same thing. And okay. Basically, there are some hot topics that are well funded, but some are not, because there wasn't some Jeff Bezos or Elon Musk or somebody who would be bold enough to fund this type of the research. So yeah, as an organization of our, yeah, we're operating on our own. We can't make any decisions basically here. So we're looking for something that only we can do in this sense, and also that could be very beneficial, potentially beneficial to the field. Sorry, I think I'm not giving you anything.
No, it makes sense. And it makes sense that you're contributing what you were able. And one of the things that your group has been able to contribute to this is identifying a really good collection and a growing collection of promising germ protector candidate substances. And I call them substances because with many of these, they're not, they haven't even made it into the FDA or anyone else's equivalent process. So it is literally just a chemical a lot of the time. And this is something that I've studied a little bit myself. In many cases, a scientist may notice an effect and identify that for further study. And then you'll have open groups like the Longevity Forum that I used to participate in. They had much of this where they would pick these up and they would say, look, this is just a research chemical. It's just out there. No one has really done much with it, but it may trigger X, Y, or Z. So I understand that your group is identifying and doing a little bit of like testing on some of these germ protectors. Could you tell me, do you have any promising candidates in that realm?
Okay, I'm afraid I will need to disappoint you because we're not doing exactly that. We started as a community several years ago, and one of our possible, solutions of how to involve more people would be these community-based clinical trials you're talking about, like Chastity are doing. But only, if I'm not mistaken, with Chastity, they are like every individual is doing something to themselves, but not in an organized way, like in a traditional clinical trial within a united protocol, right? And the good news is that there are several new projects right now in the field that are trying to tackle this this problem from this perspective. Actually doing clinical trials within a protocol, and that's what we tried to do back then. The major problem here, and I might add it, it's very hard to come up with a protocol. It's either expensive because you will need to do the proper paperwork and everything. So FDA has come up with all these rules for a reason. There are GCP regulations, well, not regulations, but rules. And these are good rules, actually, acquire good quality clinical data, do not harm the patients and everything. That's actually the good basis there.
Yeah.
And
yeah.
we need a good quality protocol. And it's very complicated to do this for Longevity, for our initiative back then, and to others right now, I believe so. Because you will need a scientist or a medical doctor who will come up with an interesting idea and who will be willing to share this idea on an open basis, right? Because if your idea is good enough, you will most likely go and find the investors and
it'll become proprietary. Yeah.
Yeah. But that's how our industry is not going forward fast enough. Everybody is trying to hide the information from one another. We're not testing everything fast enough. We're not, in the end, we're not getting valuable data fast enough. So I see this as the major problem. It's either there is no interesting protocol idea, or there is no initial funding, like on a sponsorship level, like I'm not waiting for any return at this point, I'm just sponsoring you. So there's lack of this kind of funding at this stage of these open clinical trials. And if we want to, yes, people are ready to pay for the substances they're taking. They're ready to pay for the diagnostics if they're given the instruction, like what to diagnose, what to test. What blood work to do. People are quite ready to do that, but they cannot organize themselves.
Well, Yeah, and the organizational part I think is critical. And again, I'm in my own experiences with longevity, but I spent many weeks, perhaps months on that forum. And what you're describing, what I would see is again, one of these geroprotectors would be identified, you know, and then of course the first thing would be you'd have a group of people who would say, I want this, and they would find a way to get that, right? And then you run into issues. And one of them is, okay, are they even taking the same substance? You know, I mean, some of this stuff, they were buying a chemical that was made in a Chinese lab from eBay. And, you know, and so there are questions about that. But then one of the other concerns would be, a lot of the time they would come back and say, well, it didn't do anything, or I think it did something, or it might have done something. Some of them would get lab tests and they'd say, I feel great. And it would turn out they were taking 10 different chemicals from different, you know, and so then the issue is, well, which one is making you feel great? Because the others may not do anything. So what you're describing makes a lot of sense. Being able to take the data from this, being able to basically cross correlate that and find things that truly work.
I like the projects as longevity because, you know, we're not losing people there. They're still sticking with the idea, with the industry, with the movement. They're getting used to the idea of experimenting on themselves. It's just the next step for them and to longevity, to the people in the community, to then join a more like well-organized movement of, you know, for us to acquire, you know, actually usable data there.
Now, is it okay to ask about the Boston matrix? That's something that I'm not familiar with. It was on your website. I guess the idea is to develop a theory that a therapy that prevents age-related degradation of the extracellular matrix in the cell. And the focus is on small molecules that have the potential to slow down aging. Could you tell me a little bit about the idea behind that?
Yeah, actually, I love extracellular matrix as an object. It's a very interesting thing. So maybe not everybody knows that, but we're not, you know, our body is not made only from cells. Though when you're hearing about aging biology, most of the talks on the conferences and everywhere, scientists are talking about the aging of the cells and everything that is within the cell. But there's actually the whole life in, you know, outside the cell, in between the cells. And its structure is called extracellular matrix. It's not only, you know, like a mechanical carcass the cells are sitting upon, but the cells, you know, they can communicate with the matrix. They can measure how hard it is, like the chemical property of it. The stem cells migrate to, you know, to the parts of the body where they will then, you know, turn into the needed cells there, and they migrate using the extracellular matrix too. So it's very important how the cell communicates with its microenvironment there, not only with other cells, but the matrix. So its state is very important. That's like one interesting part about it. Another thing is that most of the extracellular matrix is done. It is built out of long-lived proteins, collagen and elastin and some other molecules there. So they live long, and that means that they collect the bad things happening to them. They're not being like exchanged fast enough during our lifetimes. And in some parts of our body, extracellular matrix is being renewed quite fast. It does get renewed. Like some tissues have a lot of matrix, and this is connective tissues mostly. Like your skin is one of the great examples. Your joints, your like muscular system there. So the joints are a bad example. You know, not a bad example, but it's an example of how long it takes to molecules to renew their. It's more than 100 years. So basically, you're being born with the extracellular matrix there, and that's what like you
That's what you
cooperate
have.
with.
Yeah.
That's what you have. Yeah, yeah. You don't really have a chance to renew it. In the skin, it's a little bit better. It does like renews several times within your lifetime. I think your tongue is even more, even better in these terms. So yes, in some parts it's better than in the others, but still it collects the crosslinks. So the extracellular matrix is being done is are long-lived proteins, and we're as a human being constantly consuming carbs. It doesn't really matter whether you're eating sugars or not, like fast carbs or not, you're still consuming carbs. And in the end, and you need to consume them, that's like a very crucial part of your diet. And in the end, it will be, you know, contacting with the proteins of your extracellular matrix, not only with that, of course, but the whole body, but in terms of matrix, and it stays there. So if I'm talking like very, very oversimplified here, like there are these long molecules of collagen, and the sugars are just creating the crosslinks in between these fibers, and it's making the extracellular matrix stiffer. So just, you know, from a mechanical point of view, the cell, it can tell that it is in the aged matrix. And also from the chemical point of view, it also can tell, because these crosslinks are AGEs, advanced glycation end products, and they are called end products for a reason. It means that these products are being created in the end of the chemical reaction, and there's nothing you can do with them in the end. They're just staying with you there. And it's very hard for our body to, you know, clean the matrix from these things by ourselves. It's like almost impossible.
Yeah. So you're really talking about a scaffolding. It sounds like this is kind of the scaffolding that the cells are built on, and damage to that scaffolding sounds like it's probably magnified because the cells use that. They use it to communicate, they use it to move, they use it to, yeah.
And also these AGEs, the cell reacts to these AGEs, the crosslinks that are AGEs, just the same thing here, that reacts into this as to something, to some bad thing, the same as they would react to some parts of the, okay, I forgot the word, sorry. Okay, basically in the end, it will react with the inflammation. And you probably heard about the fact that during the aging, the level of inflammation grows, and for no reason, sort of for no reason. You're like, no, you're not sick, but for some reason, the level of inflammation grows. So a lot of scientists are calling this inflammaging, calling the inflammation one of the main causes of aging. And this is a deterioration process that, you know, just bothers our body. The cells we are accumulating these crosslinks, and the level of inflammation grows, basically. So on the chemical level, on the mechanical level, is bad. And we need to do something about it. First of all, we need to, you know, lessen the speed of how these crosslinks are appearing in our body. The second, which is more complicated, to build, you know, to come up with some small molecules that can cut these crosslinks, but in the proper way, because some of these crosslinks are actually needed, because some of them are part of the structure, of the needed structure of these long molecules. You can't just cut whatever you want, whenever you want, obviously, in our body. Yeah, but what I love about tackling the extracellular matrix pathway of aging is that it hasn't been addressed well during those years of aging research. It's not even in the hallmarks of aging article. You probably know this article is like the most popular article in aging biology, the hallmarks of aging, like the list of you know, of the ways how we age. And everybody in scientific community, well, no, I cannot say everybody, I cannot say for everybody, but most of the scientists are agreeing that extracellular matrix aging has to be included in this pantheon of hallmarks, and it's not there yet. So yeah, it's just something that we haven't tested properly yet, and we should.
Now,
That's what I'm about.
and thank you. Are you looking at other? I mean, I know there are so many avenues of research right now. Another one that I just read about was Dr. David Sinclair. He has been working with NAD boosters for quite a while. He also just published an article about Yamanaka factors, and apparently, if I remember right, they were applying 3 of the 4 Yamanaka factors to rats or mice genetically, and then using an antibiotic as a trigger for those to reverse aging. Are you looking at anything along those lines as well?
Well, it's only logical that we came up with a 3-staged program there that includes both the possible rejuvenation of matrix and yeah, this epigenetic rollback of the cells that you were talking about.
And that would be the NAD boosters, I think. Yeah.
Well, there's like a number of ways you can do that, but you have to do both. You have to epigenetically roll back the cells to make them younger, but also you will have to prepare the media where you place those cells, because if the matrix is old, the cells won't be happy. And well, there was research that showed that if you're using stem cells and you're placing them in the aged environment, they can tell they're not happy, inflamed, they're not, connecting good enough to the environment, they're not surviving good enough in the end. So yeah, you have to do both here.
Okay. Yeah, you're saying it's multifaceted, and you can't. There's not just one magic bullet. It's going to take a lot of different things. So, yeah. Well, let me move on a little bit to transhumanism in general, because you're part of this community. This is a large and rapidly growing community as the baby boomer generation ages. So, has Open Longevity been able to work effectively with other groups and organizations in this area, or is your work mostly self-contained?
Of course, we know other groups, yes, and transhumanists, well, most of them know each other. I'm not so optimistic as you are. I wouldn't say that it's growing fast enough, but you're right, it does. It does. I can tell that I was very much inspired when I was on a scientific conference in San Francisco like a month ago, I guess. It's an annual event. Every year, biologists come there, talk about their biological research, but it was always traditional biology there. Not enough people were talking about organizational solutions that were mentioned today. But now, like a month ago, I've seen a lot of new people there, transhumanists, people that are not afraid to tell that they are actually in favor of radical life expansion, not only fixed biology at a couple of years, stuff like that. And they are on another level. These people are, they know how to present themselves. They know how to organize their projects well enough to be funded. So it looks better. It looks much better this year. Like every year, transhumanistic community looks better and better. More capable, more presentable, more. I don't know. I've seen like several projects I would love to join. I would love to help. I wouldn't be ashamed to be a part of. So it's always great.
Yeah. Well, now in terms of your organization, and I think I understand this correctly. It says yourself and Misha Batin, and hopefully I'm pronouncing that right. Yeah. You are the 2 key influencers in your organization. Can you tell me how did you both come together and how did you start this? What was the thing that started you both to then start this community of your own?
Oh, Misha actually hates the fact that we're like the two of us are emphasized on the website. He asks me, so we're a community. It needs. I don't
That's
like how it looks.
that's the burden of leadership. The burden of leadership. You get the spot on the website, and people say, "Well, how did you start this?" So now,
Yeah, okay, sure. So we met. How many years ago? I think in 2014. I first met Misha when he already was the president and founder of Science for Life Extension Foundation, which I now represent as a vice president. So yeah, he established this foundation in 2008. So yeah, he was in the industry for quite some time now, and I helped with organizing one of his scientific international conferences in Sochi in Russia. Then I went on do my design job for 2 more years. But you know what? If you want to solve huge problems in the world, if you want to improve it, you will come up with some or the other transhumanistic project. And yeah, then we reunited and started Longevity together. I can tell that Misha inspired me greatly. He's he's great in terms of influencing. He's a philosopher. He's a modern philosopher. I can tell that. I think he inspired so many people in Russia, both scientists and investors, many more. So I would say, yeah, of course, I went into science like back in the days when I had to make a decision, like being a kid. You have to decide what you're going to do with your life. And I made a decision that I wanted to do biology, do very important things in the world. A very romantic idea that I was probably influenced by movies, I don't know, books. But I kind of lost the connection between this solving the world problems and science when I was in the university a little bit. That's why I proceeded with some other careers there, but Misha brought me back. So
okay.
Yeah, great kudos to him for that.
He reignited that passion that originally got you into biology. That makes sense.
Yeah.
That makes sense. Well, Anastasia, I want to thank you again for your time today. I think that we're just about out of time for today. I want to thank you so much for joining me. I would love to have you back in the future. But
I love it.
yeah, absolutely. I think the work that you guys are doing is brilliant. I think that what's happening right now in anti-aging medicine is tremendous. It's absolutely the right research at the right time. It benefits all humanity. There's really no downside to it. No one suffers from this. It only lifts people up. So
I love your attitude. The field is huge. It is very, very hard to talk about it within this small period of time. I'm sorry, I don't think I answered any of your questions, actually.
No, it was wonderful. It was wonderful. Thank you so much for joining me today.
Yeah, same.